Good afternoon and welcome. Hi, I'm Jenny Medlin, an education and outreach specialist with your Missouri Loggers. It's a pleasure to have you here this afternoon as we have reached out and coordinated with Cindy Carr and Gary Gummig of Missouri Claim in order to present information on Medicare. So thank you again for joining today's Medicare 101 webinar. Please welcome Gary Gummig, a strategic outreach team member, and Cindy Carr, a regional liaison, claim trainer, and benefit enrollment center coordinator for today's presentation. Throughout today's presentation, your microphones are muted as well as your web cameras have been disabled, so we will not be able to hear or see you. However, if you have questions, you're welcome to type that into the chat feature or by using the Q&A feature, which you should be able to locate in the navigations of your screen. Again, if you have questions, please submit those. Cindy Carr and Gary will be monitoring those and helping to answer those throughout today's presentation. Thank you again for joining. I'm going to hand it over at this time to Gary and Cindy.
Thank you very much, Jeannie. This is Cindy Carr. I am regional liaison for the Central Missouri region. I have done the Loggers in the past for you guys, and now we have a new strategic outreach team that is handling a lot of our outreach. And so I've invited Gary here to help do the presentation. I will be monitoring the chats and the Q&A. So if you have any questions, let us know. We're also going to do a little hand raising for questions and answer sessions near the end. So find that hand raise button for you on your menu. And after that, excuse me. And so I'm going to hand it over to Gary. Gary, take it away.
Thanks, Cindy. It is a pleasure to present to you today. Just a little bit about my background. Cindy mentioned the strategic outreach team. That's a fairly new team at Claim, and really it's just designed to, just like the name says, really find good ways to reach more Missourians to assist them with their Medicare questions. So Medicare 101s are certainly part of that. And so without further ado, we'll go ahead and get started with the presentation. All right. So what we're going to be going over today, really kind of a program overview of Medicare. So again, think of this as, it may not be a 10,000 foot overview of Medicare, but it may be more of a 5,000 foot. We get into some details, but Medicare is a pretty complicated and detail oriented program. So there's a lot of ins and outs that we certainly couldn't cover in an hour or two. So we'll kind of take the high road here. We're going to talk about eligibility and enrollment. So when people can get on Medicare, how to enroll, when to enroll. And probably one of the things, in addition to being part of the strategic outreach team, I'm also a claim volunteer. And what that means is I work with Missourians that have questions. They submit questions to the claim call center, and we set up meetings, whether it's Zoom or phone or in person, to help them with those. Probably the number one question we get is, should I do original Medicare, a supplement, a Medicare Advantage plan? And so that's a big part of this presentation, is to kind of help you get your arms around the difference between the different options with Medicare. Prescription drug coverage, a lot of different plans in Missouri, so we're going to go over some of those plans with you, and then just some case studies, some kind of fun to kind of reinforce what you've learned in the presentation, and to see what you would do. So it might not be John Quiones, but we're going to play What Would You Do? So we'll start out with just who's Claim, and we're known by other names, the Missouri SHIP, or the State Health Insurance Assistance Program. And CLAIM just stands for Community Leaders Assisting the Insured of Missouri. So if you were ever wondering what CLAIM stood for, that's it. But really, we're the State Health Insurance Assistance Program, or the Missouri SHIP. So created by Congress as part of the Medigap reform, and we do provide Medicare education to Missourians to providers to beneficiaries as well. So, and we give feedback to Medicare and Medicaid, work closely with the Department of Insurance, with Missouri. And probably, one of the most important things or the unique things about claim is claim counselors don't sell or promote any insurance company or its products. And that's why Missourians feel comfortable coming to the Missouri SHIP, is because they know that we're unbiased. We don't have a dog in the fight other than to help the person get their questions answered, help get them the best coverage for their particular situation. And so, we're not agents, we're not brokers, none of that can't be to be a SHIP counselor. And you'll see our 800 number down there at the bottom. So anytime that you have a question that and we didn't say anything, but please no personally identifiable information in the chat or the Q&A. If there is some things that you want to talk to a counselor about, we'd suggest calling the 800 number to get a counselor. So we don't want any personal identifiable information as part of the chat. So again, how the claim counselors help. Enrollment and billing. There are billing questions that come up. And again, Medicare Advantage is probably our number one, I would say, followed closely by the prescription drug program that we help people with. But we can help people with appeals. We can, if they suspect fraud, if they think someone has gotten their Medicare number, we can put them in touch with people to help with that. Medicaid, some of the Medicare savings programs to help people that can't afford the premiums. It's a wide variety of things that the claim counselors do. And it's a very rewarding volunteer position, and I strongly recommend it to you guys. If you have the inclination that you're looking for something after retirement, this is a great gig. So, okay, let's dive in. So what is Medicare? So just like the slide says, it's a health insurance program for people, two kind of groups really. You can age into the program, which means you're 65 years or older. And that's the way the majority of the people get into the program, is age in. You can get into Medicare if you're disabled and under 65, if you've been disabled for at least 24 months. And the disabled is SSDI, so you're receiving SSDI. You've gone through the process with Social Security to deem you disabled. Then you can get into the program as well, or end-stage renal disease or Lou Gehrig's disease. The Medicare card you see there to the right, the red, white, and blue card, it is funny when we work with people, we'll say, hey, do you have your Medicare card? And they'll kind of draw a blank because they might pull out their Medicare Advantage card or something like that. And you say, no, it's the red, white, and blue card. Used to be your Medicare number was your Social Security number. And we still have some people saying, hey, I've never gotten an updated card, which they have, but they just probably misplaced it or didn't see it come through. So it's a unique number now, not your Social Security number. And it has important things on there, like if you're covered for your hospitalization, medical, the effective dates of those programs. So CMS administers this, and even though it's, common sense would say, oh, it's a Medicare program, Medicare enrolls you. That's not the case. You actually enroll through Social Security or the Railroad Retirement Board. So a little interesting there, and we'll talk more about that in a bit. So, when I said Medicare is kind of confusing or can be confusing, we kind of want to break it down a little bit for you to help you see the parts, understand what those parts do, and kind of what your choices are, and be able to see what those choices might manifest into as far as benefits paid. And so as you see here at the highest level, so when you're deciding, hey, how do I want to get my Medicare? You've got two choices. So original Medicare, and some people call it traditional. So it's one and the same, original or traditional Medicare, administered directly by the government. So no third party kind of in between you and your health benefit there. Or Medicare Advantage on the right-hand side of the screen there. And that's private insurers that manage your Medicare through their programs. So at the highest level, those two are really there. So right now there's about 64 million people on Medicare. So just kind of round numbers. In Missouri, around 1.2 million or 1.3, I think at this point, probably closer to 1.3 million Missourians covered by Medicare. So, one of the things you might wonder is, so how many of the people pick original Medicare and how many pick Medicare Advantage? Well, I just did a quick look. This was as of October of 2021. 36 million people were on original Medicare, 28 million people on Medicare Advantage. So that's nationwide. And in Missouri, about 48% of the people are on a Medicare Advantage plan. So that kind of tells you it's almost split down the middle, at least for Missouri, as far as who picks what, how they receive their Medicare. So just to give you a little view into that. So we're going to go through the parts now of original Medicare, and sorry about that. So Part A. So Medicare is broken up into different parts, and Part A helps pay really for your hospitalization. So when you hear somebody say, are you on Part A? That's the hospital asking, do you have that specific Medicare coverage? So handle skilled nursing, home health, hospice, and it's typically premium free for most individuals if you or your spouse have 40 quarters of employment where you paid into the Medicare program. So most people have that. I mean, I have run into people that I did help a lady that she said, hey, they're wanting to charge me for my Part A, and she didn't know her Medicare number and didn't have a Social Security.gov account set up. But we finally figured out she didn't have the 40 quarters, and her husband didn't either. And so that's why they were charging her a premium for Part A. But typically premium free because you paid into the system for 10 years or 40 quarters of employment. Part B is really, think of that as your doctor. So you go to the doctor's office for a checkup, Part B is going to help pay for that. If you go into an outpatient facility, that's a Part B as well. And your diagnostic tests, your therapies, some preventative health, durable medical equipment, your wheelchairs or insulin supplies, stuff like that would be Part B, paying for that. Outpatients, again, we talked about that is Part B. So that's covered with that. And both Medicare Advantage and original Medicare, they both have this Part A and the Part B. So what does this cost you? So a lot of people just assume once they get on Medicare, everything's paid for and they don't have to pay for anything, but not quite the case. So on Part B, your cost, you have a monthly, again, we said Part A was premium free typically. So you're okay there. Part B, most people, and again, Medicare is full of twists and turns or exceptions, if you will, but most people pay $164.90 a month. And that premium changes each year. So they'll determine at the end of the year kind of what they're estimating the costs are going to be. This is actually down about $5 from 2022. So it did go down. That doesn't happen very often. Typically goes up a few bucks a year, but $164.90 a month is the amount. Now, if you're a higher income individual, if you make closer to 100,000, if you're a single, closer to 200,000 married, or 97 and 194 to be specific, they do bump that premium up because they assume that you can afford to pay a greater share of that premium. So for the higher individuals, and they go back 2 years. So that's kind of the look back, is when you turn 65, they kind of look back 2 years and say, what were you making a couple of years ago on your taxes? And that's what we're going to use to determine IRMA. Most people have the premiums taken out of their monthly Social Security or railroad benefit accounts, assuming that they are collecting those benefits already when they start Medicare. We tell people that's usually the best way to do it, because if you have it coming out of a checking account and something happens with that checking account, you close it, or something happens and you don't pay your premium, you could get canceled, and that would be kind of a bad deal. And I had that happen to a snowbird that had it coming out of their checking account, and again, something like that happened to where they weren't putting money in it, so they weren't getting the premiums paid, and they canceled it. And they had to wait till the next enrollment period before they could get coverage again. So having it taken out of your benefits is probably the best way if you're getting your benefits. If you're not, you can get billed every 3 months for $494.70 this year, or if you want monthly Medicare Easy Pay, you can sign up for that and get make your payments monthly. So several different ways to pay your Part B premium.
And Gary, we do have a question.
Okay,
Is the 164, is it per person per month?
good question. It is. Medicare is unique to individuals. So, when you're used to having group coverage through your employer that covers your spouse, it's not like that on Medicare. So it is $164.90 a month per person per month. Good question. Okay, so a little bit more about Part B. So there is an annual deductible of $226. That's in 2023. Again, that amount changes each year. And Medicare is an 80-20. So Medicare pays 80% of the cost. You pay 20% of the cost, or that's your coinsurance of the Medicare approved amount. So right off the bat, when you start out the year, you have to pay $226 that's not subject to your coinsurance. And again, that's not unlike some of your group employer plans where you have an annual deductible. A couple of terms that you need to be aware of. Assignment, that's probably the most important thing to kind of take into consideration when you're going to a provider, is do they take Medicare assignment, which means they've agreed with the prices Medicare has set for the various procedures, and they're not going to charge you any more than whatever Medicare said that they could charge. So that's kind of the best case scenario, and most of the people that do Medicare assignment, but there are some that do non-assignment that say, I'll take Medicare, but I'm going to charge more for that procedure than Medicare allows, and the beneficiary is going to be responsible for at least up to 15% of that excess charge. So if you could ask a provider, do you accept Medicare? And they may say yes. If they don't accept Medicare assignment, you may pay 15% more than Medicare allowed to be charged. And then just kind of, again, a little gotcha. Critical access hospitals of 25 or fewer beds, that 20% coinsurance might be based on a higher amount than it would in a larger hospital. So there's some exceptions made for critical access.
Gary, we had a couple more questions I'd like
Sure.
to address.
Okay, go ahead.
Someone asked if we could give more detail on the IRMA calculations. If you go to the website medicare.gov and just type in IRMA, it will tell you the different percentages and the different increases depending on the income that you can find on that website. Again, that's medicare.gov. Okay, they have a chart that they put on there every year for the IRMA. And they also ask, is it calculated every year? It is not. If your income changes, you do need to contact the Social Security office to have the IRMA decreased or removed. And you can do that through the Social Security office. So it's going to be a fixed rate at whatever you did when you turned 65, the 2 years before that. And if it changes because you're no longer working, you can go back and ask them to reconsider at the Social Security office to maybe get that IRMA charges reduced. Okay. We also had someone else who said you're cutting out. You're not cutting out on my end, Gary. So I'm wondering if maybe it's their internet. I don't know if anybody else is having that issue. And there's another question. Is the deductible the $226 per month per person?
No, it's an annual deductible.
But it is per person because everybody's an
person,
individual.
Yes.
Okay. And I have another one who replied saying you're not cutting out on their end. So the person who's having trouble cutting in and out, it may be your internet. You might want to check that. Thanks, Gary.
You bet. And I'll try to make sure I speak up as well. So, and if I don't, raise your hand and say, speak up. So we talked about this a little bit earlier as far as how to enroll. If you're, well, kind of two ways here. You can call the Social Security Administration. You can make an appointment to go to a Social Security office. You can go online, which is, I think, by far the easiest. And especially if you have an SSA.gov account set up already. And I would suggest that if you don't, that's a great thing, especially as you get close to retirement, to make sure that your earnings look right and everything looks good, and it just makes it easier to apply to do that. So you can go to Social Security. If you're part of the railroad community, the Railroad Retirement Board is kind of a separate path for you. And we've got the details there as far as the phone number and the website to apply. So one of the things, if you're already receiving your Social Security benefits, so you maybe started when you were 62, you just said, I'm going to start drawing my Social Security benefits now. If you're drawing those benefits when you turn 65, you'll automatically be enrolled in Medicare Part A and B. And so you shouldn't have to, in air quotes, you shouldn't have to do anything. It should be an automatic thing. Now, some people will say, well, I don't want Part B because it has a premium associated with it. And I've got group coverage, so I don't need duplicate coverage, so I don't need to pay for it. You can contact Social Security and decline Part B. So you can say, hey, I don't want Part B. I'll take Part A because it's premium free, because I've worked enough and it can act as a supplement, but don't give me Part B. So you do have that option, even though it automatically gave it to you. So once you get your red, white, and blue Medicare card that says Part A and Part B, you can call them and say, don't want B, and they'll send you a new card.
We do have a question in the Q&A that we are going to get to a little bit later, Gary. If I'm not retiring until I'm 67 and fully covered by my employer's insurance, do I sign up for Part B when I sign up for Part A?
Yeah, and you're right. I'm going to have them wait just a little bit for that answer, if that's all right.
That'll work. Thank you.
All right. Yep. Okay, so when to enroll? You've really got the initial enrollment period is, and think of it as 313 before your 65th birthday. So you're 3 months prior to your 65th birthday month, you can apply for Medicare. It won't be effective until your birthday month, but you can apply 3 months before your birthday month and 3 months after your birthday month. So, and we talked about being automatic. And so that question that just came up, can you opt out if you are covered by an employer group plan or from your spouse's active employment. And yes, you can opt out. And again, a lot of people say, I don't want to pay for duplicate coverage. And so there won't be a penalty as long as you have credible coverage from your employer, which means it's as good as what you would be getting with Medicare. So, and your HR department, anytime, I didn't say that earlier, but boy, I would encourage you anytime that you're getting ready to enroll with Medicare and you're still working, meet with your HR folks to figure out how the insurances will work together. It's a good check. So, so if you enroll 3 months before your 65th birthday month there, it'll be effective when you turn. And the month, if you do it after, the next month, it'll become effective. So it's actually a pretty good deal. This actually changed in the beneficiary's favor as of last year. So that's a great deal. So in addition to an initial enrollment, there's something called a special enrollment period. And this goes directly to the question about if you or your spouse continue to work and have active employer coverage after you become eligible for Medicare. So when you find out that you've worked a couple of years past 65 and you say, okay, now I'm ready. I'm going to lose my group coverage, so I need to pick up Part B. So you get a special enrollment period. It lasts for 8 months for Part A and Part B, which is your hospitalization and your medical or doctor, right? As we kind of reviewed there. And you get 63 days for Part D, which we haven't talked about yet, which is your drug plan. So again, no harm really in enrolling in the premium-free Part A at 65, and then using the special enrollment period to enroll in Part B when your coverage ends. And we're going to talk about why this active employment employer coverage is important here coming up. So again, this gets a lot of people, the active employer medical plan. Some people get retiree coverage, and they feel like that should be okay. But with Medicare, that's not okay. That does not count towards credible coverage if it's not active employer medical plan, if it's retiree coverage. So a couple of things too, as far as which plan pays first. If a company has 20 or more employees, then the employer plan will be primary, the group plan will be primary. Otherwise, it switches and Medicare is primary. So, and if someone is on Medicare and under age 65, which would mean they're disabled, it takes 100 or more employees for the group insurance to be primary. So again, this is why working with your HR department is really kind of important, because you want to know with your specific situation who pays first, because it can be very important on how much you would have to pay for some coverage. So again, we talked about the special enrollment period of 8 months to enroll in Part B, to sign up without a penalty. You can get COBRA, but it's secondary to Medicare. And you can enroll in the Medigap, prescription drug plan, Advantage plan, all within those timeframes that we talked about, the 8 months and the 63 days.
And Gary, we have another question.
Okay.
So is that 20 or 100 active employees or 20 to 100 covered employees? And that is active employees. It can be full-time employees. It can be part-time employees. They just have to have that many employees on their payroll. They don't have to be in the group plan. Okay.
All right. Thanks, Cindy. Some gotchas, if you will. If you are contributing to a health savings account with your employee plan, you need to discontinue those contributions really 6 months prior to your Medicare enrollment. And that's because of tax consequences that the IRS will tax those contributions differently and not a favorable way. So that's the recommendation, is to discontinue those contributions 6 months prior. And again, we kind of beaten this one in the ground, but the employer coverage just protects you against late enrollment penalties if it comes from active current employment, yours or your spouse's. And COBRA is not coverage from active employment. And we talked about the number of employees. So we'll keep going there.
And we have had cases, I know I've had some cases where people were on a retiree insurance and they were not on Medicare. So their retiree insurance refused to pay the bill because they were supposed to have Medicare first. So you really need to watch out for that and make sure you know which one's going to be primary and which one's going to be secondary.
And that could definitely be a big hit, right, Cindy? Because Medicare would have paid 80%.
Correct.
And now then, that's your responsibility.
Exactly. I mean, they're responsible for the whole bill.
Right.
Because they didn't have things in place. Yes.
So big impact. And that kind of comes right into this scenario. We just thought it's good to kind of reinforce, just use some examples with some real numbers, and we'll kind of walk through if you have original Medicare or original Medicare with a Medigap or a Medicare Advantage, the same scenario, but you know how it's different on what you may have to pay. So in this example, Clara had a 4-night hospital stay. She had a heart attack, and the hospital and doctor bills were right at $500,000. So that's kind of the scenario that we're talking about. Original Medicare, so just parts A and B is what we're talking about here. You'd have a hospital deductible of $1,600 for a benefit period, which we aren't going to really get into in too much detail here, but we'll just use it as a deductible, $1,600 deductible. Part B annual deductible, we talked about prior, $226, and the patient coinsurance of 20%, which, you know, when you go to the doctor office and it's $100, and so 20%, you know, $20 doesn't seem like that bad a deal. When the bill's $500,000, that scenario changes pretty dramatically. And so you see here that, you know, the patient would be responsible for $100,000 or 20%. So their out of pocket with original Medicare would be $101,826. So in general terms, now there's all sorts of different scenarios here that, you know, the numbers could be different, but we're just using round figures to kind of make a point here that if you have original Medicare without a Medigap plan, or or if you have
any kind of supplemental plan.
Yes, then we can get some help. But otherwise, if you don't have that, you're at risk if you go in the hospital and have kind of a major event. Cindy, did you want to add to this, or?
Well, we did have another question, but I'm going to let you go ahead and do the other slide first.
Okay, cool. So the question is, how do I reduce my exposure with original Medicare? I thought original Medicare was really good. And the answer is there's several ways. One of those, if you want original Medicare, is a Medigap plan. And one of the things that we talked, I don't think we did talk about with original Medicare, is that there really isn't a network with original Medicare. We talked about, you know, assignment and non-assignment, but we didn't really hammer home that with original Medicare, you can go to any provider you want to go to that accepts Medicare. And so your network is nationwide. Your network is vast. That's one of the major benefits that people see with original Medicare, frankly, is the choice of hospitals, doctors, providers. So that's kind of an important thing to remember. So on a Medicare supplement, it works with the Medicare Part A and B. So it's specifically designed to cover those out-of-pocket costs that I listed on the previous page. So the deductible, that $1,600 we talked about, the co-pays, the co-insurance of 20%, which was the $100,000. A Medigap will insure those out-of-pocket expenses, so you don't have to cover them. The secondary or Medigap person will cover that. And so you'll hear Medigap described as a Medicare supplement, a Medigap plan. You might hear a Plan G or a Plan F. All these are Medigap. They're kind of one and the same, kind of different terms used for the same thing. So if something is covered by Medicare, a procedure is covered by Medicare, like the heart attack, then the Medigaps cover that excess. If it's not covered by Medicare, so maybe it's a cosmetic procedure that you had done that's not covered by Medicare, well, it's not going to be covered by the Medigap either then. So if Medicare is going to decline it, the Medigap provider will decline it. And so it doesn't come into play with your prescription drugs or dental work, hearing, vision, because Medicare, original Medicare, don't cover those things. The Medigaps are written by private insurers, and we'll talk a little bit about that on following slides, but it's private insurers and it's an additional premium. And we'll talk a little bit about the additional premiums that go along with Medigap, because it's not just kind of a gimme, if you will. It's not like the Part A part of the plan. It's an additional premium that you can choose. It's an optional part of coverage that you can choose for your health care. The one thing to remember is, and it's a good thing for consumers, is Medigaps are standardized by the government. They have assigned letter names and you enroll directly with the company. So the standardization from a consumer standpoint means you can compare apples to apples. So for instance, there may be a plan that says I'm going to cover all of the deductibles for Part A. I'm going to cover the 20% co-insurance that Medicare doesn't take care of. I'm going to give you some foreign travel protection, and all those will be the same across all companies for that plan. So no company is giving you a better option in a plan. They're all standard, and so that lets you as a consumer compare price. So, and the price will vary widely, which I'll show you here in a little bit. So to be eligible for Medigap, you have to be enrolled in Part A and B for Medicare. And the absolute best time, and there's some really kind of neat things in here for beneficiaries, is typically you have 6 months after you start your Part B to enroll in a Medigap plan with a guaranteed issue right. And what that means is you're guaranteed that you can buy a policy and they can't do any medical underwriting. So it doesn't matter what your current health or past health history has been. They can't hold that against you. They can't ask you any of those questions. They can ask if you're a smoker or non-smoker, but that's really about it. And so they can't charge you any more than any other person your age applying for Medigap insurance. And so that's a huge benefit to be able to kind of buy into the system regardless of your health status. And let's see if there's anything on this page I missed. So the enrollment period, again, 6 months beginning with that effective date. After that, so if you didn't buy a Medigap within that 6-month open enrollment period, then the company can actually do medical underwriting. They can ask you all sorts of health questions. They can charge you more for the same coverage. So you definitely, and they can decline you if they think you're not a good risk. So again, the time to get it is right when you sign up for Part B, in essence, within that 6-month time frame.
And Gary, when I talk about the Medigaps, I talked about them like car insurance or your house insurance, where you pay a premium every month just in case something happens to you that month, that it's going to cover it for you. So it is a prepaid monthly expense, but it ensures that if anything happens to you during that month, the Medigap will help pay for part or almost all of those costs if something tragic happens health-wise.
Right. No, and that's absolutely right. And you hear people brag about their Medigap plans, and they'll say, I went in the hospital, I came out and I didn't have a bill. And so when they're considering their health insurance, and their health care, I should say, they aren't worried about the procedures that they're having while they're in the hospital, because they know they're going to get paid for. So it's a good feeling. That's probably one of the number one things that people like about it.
And another good thing about it is you have to remember that the Medigap travels with you. Your Medicare, original Medicare and Medigap will travel anywhere in the United States. If you're a snowbird, if you go visit family and friends, it travels with you. All you have to do is go to a Medicare provider to use it.
Absolutely. Absolutely. So Missouri has several good things with their Medigap. One is issue age rated. So while your premiums will go up for inflation, you continue to pay the rate for the age that you purchased the policy. So as long as you stay with the same company and same letter policy. So there are multiple different Medigap plans that cover a different percentage of those out-of-pocket costs that we talked about. Some might pay 75% of your out-of-pocket costs. Some may pay 100%. Some may not pay the deductible. Some, so there is a good chart that will kind of show you that lines that out, what each one does. And the Medicare Shopper's Guide does a good job of kind of laying that out. So that's a good thing. But just keep in mind, this can be a little deceiving, because, for instance, right now, I think if we would look, kind of an average at 65 might be $160 to $180 a month, maybe a little less, maybe a little more, but that's kind of a ballpark for you just to have in your mind if you got it when you were age 65. Again, depending on the company that sells it, it will go up every year based upon inflation. So when you're 80, that may be a $300 a month policy versus $170 a month policy. And so that's one of the things that, probably the biggest reason why people drop their Medigap policies when they get older is because they've kind of progressively gotten more expensive and they feel like they can't afford them. And it's unfortunate because that's when they need it the most. So second bold item is really just ensure it fits your needs and your budget for years to come, not just kind of a one-time thing. Another good thing is Missouri is just one of a handful of states that offers the consumer an opportunity to shop around your anniversary date. So 30 days prior and 30 days after your anniversary date of your Medigap plan, you've got the ability to shop the same plan with different companies. And so if you feel like your plan has gone up more than it should have, you can do some comparison shopping, and you can switch during that period once a year. So that's a great benefit to have. Otherwise, you're kind of stuck. So if you want to change your plan type, your Medigap plan type, you'll likely go through underwriting. So you need to stay with the same plan, but you can switch companies. So we really talked about some of the shopping tips, pay the gap in healthcare costs. We showed that $101,000 that the beneficiary was responsible for with just original Medicare. So certainly we, inform the beneficiaries that there is a risk if you go without kind of a safety net on original Medicare. Again, there's about 12 types of Medigap plans right now in Missouri that you can pick from. So educate yourself on those, what they pay and the difference in premium. There's high deductible plans. There's plans that pay everything. So a wide variety based upon your risk tolerance as well as your budget. And we talked about the same benefits and the same plan. Again, that's great for consumers to be able to compare. And if you're looking for, the most comprehensive coverage on a Medigap, that's Plan G right now. Used to be Plan F, but they discontinued that plan, and now it's Plan G. And it's the same as F, except it doesn't cover the $226 Part B deductible. So pretty much the same. So we talked about the Medicare Shopper's Guide. And so this is from the insurance department, the Missouri Insurance Department. And we talked about 12 plans out there. So I can go out to the Missouri department, hopefully. We'll see. Okay. And you have that PowerPoint, so you know the URL to go to, but this is what it looks like. And it's got great information out here for you. It's got your shopping guide. It's got a rate shopper tool. It tells you about, how to kind of have a Medigap plan worksheet. So I can go into the rate shopper guide and I can select an age. Let's say I'm applying when I'm 65, I'm a male, I am a non-smoker. And we talked about Plan G was kind of the Cadillac.
Don't forget your zip code.
Thank you. Score 119, how about? And I'm going to submit. And what I've got here is these are the companies that sell Plan G in Missouri. It tells you the annual rate for the premium for that company and that plan. And it gives you the phone number over there in the far right to call. And you remember I told you that every company here is selling exactly the same thing. So it's no better, no worse. It's the same benefits that they're covering. So I can click on that annual rate up there at the top, and it just sorted it into the cheapest versus the most expensive. So you can see that the cheapest out there, it looks like, was $1,953 a year. As I go down, and I should have, let me show all of them there. So you can see they get all the way up to $4,000, again, for the same benefits that you're insuring. So from it was 1900, right? Yeah, 1953 was the least expensive to over 4,000. So it pays to shop, I guess, is what I would say to you. And so this is a great tool to be able to use to basically shop and to call up these companies and find out exactly what they've got going. The prior page also, if I get back to there's also a consumer complaint index that you can look at if you're wondering how many complaints the company has against them. So the department's also providing that for you. So lots of good tools to be able to use for your decisions around Medigap.
And we do have a couple of questions, and I have one comment.
Yep.
I do recommend if you would put your cursor, Gary, at the shopper guide. This is a very good you don't have to click on it, but just put your cursor. Okay.
Too late.
This is a very good book, and we also have copies of this in our office. If you want a paper copy instead of the digital copy, you can get a hold of us, and we'd be glad to send you one. But it's got very good information about the different companies and what they cover, and a really comprehensive chart in there to show you which plan, what letter plan covers which features, because they don't all cover the same. We are telling you the G plan is the Cadillac of plans. It covers everything except the $226 for your Part B deductible. But there are some other plans that are cheaper or less expensive to you that may cover like 50% of your deductible, or, you know, 50% of your co-insurance. So there are different costs to different plans and different coverage. So definitely check those out. That's that Medigap shopping guide. And we do have those available at claim. If you want to call our 800 number and ask for one, we'll be glad to mail you one. Now, we have a question. Is preferred or standard something to pay attention to on the rate guide?
The rate guide, the preferred and standard, was really just if you get it during your preferred and initial enrollment period for the Medigap when you turn 65, or if you've gone through some health screening for the standard.
And also, sometimes you're considered preferred if there's more than one person in your household that has a Medigap. You might get a discounted rate, and that's all preferred means. So, you know, you don't have to answer those insurance questions, but there may be, you know, you may bundle some insurance together with another person in your household, or you may use a company that bundles your home insurance with your Medigap insurance, and that's a preferred rate. It's just a discounted rate that you could get. Okay. Another question we had is, what about coverage while traveling internationally?
Yeah, that's great question. There are certain plans out there, and again, if you go out to the guide that Cindy was describing, it will tell you which plans offer foreign travel insurance and at what percent. I believe, I know G offers, I think, 75% coverage, if I'm not mistaken, Cindy. You may know the exact percentages for the plans, but
I don't know the exact percentages, but what I do recommend to our clients is when they're looking at Medigaps, just call those Medigaps. That Medigap rate shopping tool has the 800 numbers or the websites, and you can really dig into that more and just ask them your questions yourself on those, because they change all the time, and I don't want to give you an incorrect answer on that. So yeah, just ask those questions when you're shopping for one of the Medigap companies. Okay. Yep. This is a question I always love to get. Why is there such a big discrepancy in pricing for the same product?
You know, I'll let you answer that as well. But I mean, what I tell people is it's kind of like, I liken it to going to buy a gallon of milk at the store. You can get a gallon of Highland 2% milk at Hy-Vee for, I don't know, $5. You can go to Quick Trip and get the same milk for $7. Same gallon of milk, two different prices.
Right.
Companies charge what they want to charge. And I think they can count on the consumer not doing price shopping and not using tools like we're showing you here, and relying on their name sometimes.
And there's all kinds of variables in that. They may be new to the Medigap selling process, so they may start with a real low rate just because they're new to offering that type of insurance. Some of them base their price on the percentage of people they already have in that plan. They may reduce the plan because they have so many people already in there. So they might be able to give you a little bit of a discount. It just depends on what percentage of the pie they have. Name recognition is another one. Some of the name brands that you recognize more often for advertising and things, they may charge a little bit more because people are already coming to them. So why should they cut their cost? So they are allowed to set their own cost. Okay. We have someone who says, I now have an F plan. If it starts to cost too much, can I get a G without medical underwriting? I would recommend that before you switch to a G plan, if you have an F plan, which is better coverage actually, that during your anniversary date, you shop other companies who still carry the F plan. If you're talking to a company and they no longer offer the F plan at all, they may let you go to a G plan. But I would say first and foremost, I would stay in your F plan as long as possible. As long as the prices don't jump too much, even if you have to go to a different company to save some money for the same coverage, okay? Always go there first, try that Missouri anniversary. Okay, and another question, is there a rating system for these companies? And I believe, Gary, you did show them that on the Missouri website, the Missouri Insurance website. You can go there and there is a complaint index.
Right.
And that does have the rating. The complaint index is the rating tool. It will tell you how many complaints each company has gotten. Of course, their information is from 2 years ago, so it'd be 2021 information. But they do have a rating scale, and anything over 100 on their rating scale, you're taking your chances with, because they're getting complaints left and right because they're not covering things the way they should. Usually with the Medigap plans, it is seamless. You go to the doctor bills Medicare and they bill your supplemental plan, and you don't even see the bill until it's been completely paid. If that's not the way it's happening for you, let us know. We'll be glad to help you look at that. It may be that you're in one of those companies that has a high complaint rating. So we want to make sure that you get into a better company when your anniversary date rolls around. Okay. All right, let's see. Did I catch up? Are the deductibles different if you're on a Medicare Advantage plan? I believe we're going to cover that just a little bit when we get to the Advantage plan. So if you can hang on, Teresa, until we get to that part, that would be great. Okay. If I defer to draw my Social Security, can my Part B premium be withheld from my spouse's Social Security check? The answer to that, Karen, is no. Medicare and Social Security deems every person as an individual, whether you're married or not. So you cannot do it that way. Now, if you have a combined checking account, you can do an easy pay to that checking account or something like that, but they're not going to take it out of your spouse's Social Security check. All right. I think I'm caught up, Gary.
All right. Great questions, guys. Thank you for those. Yes. So Clara, we're still on Clara, and this is where we're going to start to see how much you pay depends on what type of coverage you have. So again, just to review, 4-night hospital stay for a heart attack, the bills were $500,000. We talked about original Medicare on the left, that the patient was out of pocket $101,000 because they didn't have a safety net for that coinsurance amount and the deductibles. So on the right, you see original Medicare with a Plan G Medigap. So the hospital deductible is going to be covered by your Medigap policy, that's $1,600. The Part B annual deductible of $226. We said with a G plan, the government said, nope, everybody's got to have some skin in the game. They want a deductible and they don't want the policy to pay for it. So the beneficiary would be responsible for that. The coinsurance of $100,000 would be paid by the Medigap provider. Again, just as Cindy described it, the hospital would bill Medicare, then they'd look and see that you have a Medigap, then they would bill the Medigap provider, and then your bill coming out of there, in this case, would have been just the $226 annual deductible. So a great deal. So you might think, well, why doesn't everybody get a Medigap then? Well, I mean, if I would have done this scenario, but it wasn't a hospital stay, it's just, there's a lot of years you don't go to the hospital, you go to the doctors once a year. your costs are minimal. Well, on the right-hand side, you would have paid $170 for 12 months or $2,000 and not used that policy. And again, Cindy kind of likened it to an auto policy where you have insurance, but some years you don't use it. So if you had good years, you might say, man, I'm paying Medigap $2,000 and I'm not using it. Well, that's true in some years. If we had a crystal ball, it would be great. We'd know when we were going to get sick and how bad. But again, if you are kind of one of those, I like the pay as you go type scenario. I don't like budget surprises of several thousand in a month. I'd rather pay 170 or whatever. And again, we use that as a just kind of an average or a, you know, kind of sticking a pin in a number here for purposes of demonstration. But so you take that in consideration and say, well, in this case, $226 or $2,266, that was a pretty good deal considering what the whole bill was. So you can see how not having that catastrophic kind of backdrop there could really bankrupt a lot of people for $101,826. But if you have it, catastrophic coverage, you're in good shape.
And Gary, we have a few questions. I think people are not understanding something about original Medicare and the Medigaps.
Okay.
Again, we have a question about networks. If people are out of network, when you're on original Medicare with a Medigap, you either go to a Medicare provider or you don't. There are no networks with original Medicare. It is nationwide, and your Medigap is also, okay? And then we had some questions about Medigap, that if you live in Missouri and you get a Missouri Medigap and you move out of the state and go to a different state to live, do you have to get another Medigap? You do not, because they cover nationwide, okay? So once you buy that Medigap, you can move anywhere you want to in the state, and you will still be able to have that Medigap and that coverage. The only thing you will want to watch out for is, we did have a really good question. Do I have to remain a Missouri's resident to get the Missouri Shoppers Benefit? I'm wondering if they're talking about that anniversary date. You do have to stay in Missouri to switch to another Medigap during that anniversary date, or one of the other 5 states that will allow you to do that. Okay, if you're trying to save money because the price goes up. I know I have an aunt that's in Arizona. Arizona is not one of those states that has that special anniversary rule where you can change with a guarantee issue. So she is pretty well stuck in her plan unless another Medigap plan will accept her. Okay. And then I had another question I wasn't sure about. Are Medigap premiums, generally speaking, less than premiums charged by private supplemental insurance companies? If you're talking about private Medicare Advantage, because the Medigap is the supplemental insurance according to Medicare. But if you're talking about a Medicare Advantage plan, we will get into that a little later. Okay. And then another question, which plan is good for us who live out of state? I'm sure if you live out of state, if you contact your Department of Insurance in the state you live in, more than likely they have the same information that our Missouri of Commerce and Insurance has for the state of Missouri. So each state has their own information about the Medigap supplemental plans. So I would suggest you talk to somebody in your state, or contact your state SHIP program like we are for the state of Missouri, and they'll be able to put you in the right direction. I think I'm caught up again. Oh, one more question. One more, sorry.
No, that's good.
Somebody missed, how soon do they need to apply for Part B before they retire? Can you go over that one more time, Gary?
Yeah, so for Part B, when you retire, your initial enrollment. So if you're going to, was the question were they 65 or were they older, or?
Whenever they're getting ready to retire, they've got that initial enrollment 313 period.
So yeah, just as Cindy was saying, so 3 months prior, the month of, and 3 months after. So.
And then one more quick question before you continue. I know you're showing us how much savings we could make with the Medigap, and really appreciate that. Numbers make sense, guys. So how does Medigap work with Medicare assignment? So because, do you want to answer that, Gary? You want me to?
No, go ahead, Cindy.
Okay. Because Medigaps will pay what Medicare doesn't pay, at least part of it. They're going to take the amount the Medicare assignment used to pay, and then they're going to pay their part after Medicare pays their part. So Medicare will pay 80% of whatever amount that they told the provider that they're willing to pay. That's the assignment, okay? And then the Medigap will pay whatever portion of that, depending on which plan you're on, for the difference. Okay. Somebody said they retired from Missouri, but they moved to Texas. So you can go and find out who your state health insurance assistance program, your SHIP program in the state of Texas, and they should be able to get you all the information you need on Medigaps that are in Texas. Perfect. All right.
We caught up?
One more.
Okay.
There's a question about what the difference is between Medicare and Medicaid. So Medicare is federally funded by the government to cover for insurance when you're 65 or older or disabled under the age of 65. Okay. Medicaid is state funds. Now the two can work together. And I think we're going to go into that a little bit later, Gary, about supplemental Medicaid. No, okay.
Nope, we are not.
So, we're talking about original Medicare and a supplemental plan to pay the difference Medicare does not pay. Well, some people who are lower income or limited income may have Medicare to pay first and Medicaid as their supplemental plan. But it has to be very low income, very low resources and assets in order to qualify for those programs. But the two can work together. We always recommend to use the government federal funds first. So we like to see people turning 65 on Medicaid to go ahead and sign up for Medicare so that we can save money, the state funds, for other people who need it. Okay, perfect. Now I'm done.
All righty. Well, one more part of Medicare that we talked about, or at the beginning, Part D for drug, so prescription drug coverage. So we talked about Part A being the hospital and Part B being the doctor or medical. Well, Part D is for your drug coverage, and it helps pay for your outpatient prescription meds from your pharmacy. So those monthly meds that you take, or daily meds that you take. And again, this coverage is from private insurers. And in Missouri, there's 30 some different insurers out there that provide prescription drug plans, which intimidates some beneficiaries because they say, my goodness, there's 30 plans out there. How do I know which one's the best? And that's kind of where claim comes in, which we'll talk about how we help people with that. But you need you need to have Part A or Part B or both, and live in a Part D service area to be eligible for a prescription drug plan. So on eligibility and enrollment, there is a site out there on Medicare Gov, and you can set it, and we would encourage you to set up your personal account on Medicare Gov, because it lets you comparison shop, not just on drug plans, but also on Medicare Advantage plans. And each plan is different. So you key in your drugs. It goes out and you say what pharmacies you want to use, and it will compare all the drug plans available in your area and tell you, based upon the monthly premiums associated with those plans and the drug costs, which plan is best for you from a financial perspective. So each plan's going to be, each company is going to have their own formulary, which tiers the drugs fall into, how much each of those is going to cost. Some have preferred pharmacies, Walmart has a plan out there, and of course Walmart is their preferred pharmacy. And most of the time your costs are lower using a preferred pharmacy. Not always. I've seen instances where standard pharmacy was actually lower cost than preferred, which didn't make any sense to me. But again, the plan finder will basically do the heavy lifting for you and be able to sort that out, and really does a good analysis, a good comprehensive analysis of which is going to be the best plan.
So I have a question for the audience. I warned you guys, I'm going to have you raise your hands, right? So find your raise your hand button. How many people out there have actually used like marketplace.gov for the marketplace insurance? Has anybody out there done that? If you did, raise your hand. See, a lot of people know what that website is, right? Well, that's for marketplace insurance. If you need Medicare insurance, it's medicare.gov. You can get any of your answers about Medicare. You can get when to sign up on Medicare. You can get the IRMA rates on medicare.gov. And you can look up a prescription drug plan when you're getting to that point that you may need a prescription drug plan, to look up the different plans available to you. Just remember, if you ever want a second opinion, or if you need help getting there again, give us a call. That's what we're here for. We get grant money from CMS just to do this and to help you find those answers. So call our call center and we'll be glad to help you.
Absolutely.
Okay, I'm off my soapbox.
No, that's great. And again, initial enrollment, we've gone over the Part D several times and the enrollment period, so I won't beat that into the ground. But same as original Medicare. And as always with Medicare, there's special considerations, events that might give you a different enrollment period, whether that's, losing your coverage from your employer plan, you move out of state, which we've heard a couple times, move in or out of a nursing home, newly approved, or loss of extra help, which is a program from Social Security that helps reduce your drug cost and premiums and coinsurance. Release from jail, you can see different ones here. And some of the things that we do as claim counselors is, when people are kind of between a rock and a hard spot, and we're, as counselors trying to figure out ways that we can help them, change plans or something, we'll kind of put our heads together and look at some of these items to figure out, hey, is there a way we can get a special enrollment period for this person so they've got the ability to change? So as Cindy said, don't hesitate to call that 1-800 number for help. So how much do these cost, the prescription drug costs? Again, it varies. So national average, about $32, $33. I think the cheapest plan I saw was maybe around $7 or $8, something like that. Most expensive might have been 120 or 101, I can't remember which. So, and they all have different deductibles. Some don't have any, most have at least that, well, a lot of them have the $505 annual deductible anymore that we looked at. So again, different co-insurances, but that plan finder will sort all this out for you to show which plan is the best financially. A big deal is insulin capped at $35 a month. That is huge for diabetics. That used to be, we would help so many people that would come in and say, I can't afford my insulin, so I just don't take as much as I'm supposed to, or I take it every other, or whatever. So that's a big change and a big benefit to take into consideration. So this is great. another question I get from people is, well, I'm not taking any prescription meds, so why do I need a drug plan? Or I'm not going to buy a drug plan. Well, and I understand you don't want to pay for something that you're not using, but again, go back to the auto insurance. You don't know mid-year what your drug prescription costs may be. You may go to the doctor and all of a sudden be put on an expensive drug, and you want to have a drug plan. And Medicare will penalize you if you don't have a drug plan in place when you could have had a drug plan in place. So when you turned 65 and got on Medicare and you had your initial enrollment period and you said, I'm going to wait. Well, there's penalties associated with that waiting that stick with you for the life of your Medicare plan. So what we usually tell people is, if you're not on any drugs right now, pick up the cheapest drug plan out there. So you're covered, so you won't be accruing penalties associated with not having a drug plan in place when you could have. So that's one way to avoid that. We talked about the late penalty, and that's 1% a month without coverage times the national benchmark, which was around that $32 or $33 monthly premium. So that's the penalty that you'll have to pay each and every time once you pick up a drug plan. So 12% a year or 1% a month, however you want to look at it, is the penalty time the national average. So again, a good way to avoid that is to just pick up the cheapest one out there if you aren't on any prescription meds right now, and then you're covered. Okay, so again, Medicare choices. We've talked about original Medicare, we've talked about Medigaps, we've talked about Part D, and we really haven't talked about Medicare Advantage. And at the beginning of the presentation, if you'll remember, we said kind of two ways to get your Medicare at the highest level: original with some optionals, or Medicare Advantage. So which side of the fence do you want to be on? So that's kind of where we're at now. So Medicare Advantage, you see them on TV all the time with the celebrity spokespeople, singing their praises. And we talked about kind of where Missourians weighed in. About 48% of the people are on Medicare Advantage plans in Missouri. So 52% have the original. And again, this isn't the same as a Medicare supplement or a Medigap. It's an alternative to original Medicare Parts A and B. So it's private insurers that basically manage your Medicare benefits for you. So there are networks associated with a Medicare Advantage plan, so you need to stay within the network. What's covered under Part A and B with original is supposed to be covered under Parts A and B with the Medicare Advantage. So these Medicare Advantage programs can have a monthly premium. Lots of them don't have a premium anymore. So a zero premium Medicare Advantage doesn't mean you don't still have to pay your Part B premium of $164.90, because you do. Either way you go. But there's no additional charge for a Medicare Advantage plan in a lot of cases, which is a nice deal. It usually, and again, I'm using some words here that have some exceptions, but yeah, usually it includes prescription drug coverage, so you don't have to buy a separate drug plan. So I kind of talk about Medicare Advantage like I would kind of like your internet tries to bundle your TV and internet and phone all in one kind of convenient package for one price. Kind of the same thing with Medicare Advantage. They like to bundle different benefits, like your prescription drug, Part A and B, vision is many times included, dental many times included, hearing coverage included. And so within their network that you have to stay within to get your service at the agreed upon price, you can have these benefits, and they have different coinsurance and deductibles based upon the different plans. So again, it's a area where you need to go out and do some analysis, and we'll show you some tools for that. But the big thing, the big advantage of, well, I consider it a big advantage for Medicare Advantage, is it has a maximum out-of-pocket benefit, which if you go back to the original Medicare example that we had, the 101,000 out of pocket, because there wasn't any coverage for catastrophic loss. Well, Medicare Advantage have a maximum out of pocket that says you won't pay any more than a certain dollar amount, regardless of how much expense you incurred in that year. So that's your safety net with the Medicare Advantage plan, is that maximum out of pocket. So it's something to really pay attention to as you look at these plans.
And Gary, like I said, with the Medigap plans, they are kind of like a prepay. You pay a monthly premium, whereas the Medicare Advantage plans are a pay as you go type of plan. So whenever you go to the doctor, you'll have a copay. Whenever you go to the hospital, you'll have a copay. But if you don't go to those items or those providers, then you don't have to pay anything.
Goes back to that crystal ball, right, Cindy? If you knew
Exactly.
if you were going to get sick, you'd know what was the best scenario for you in a certain year.
If we all knew what was coming up, we'd all be wonderful, wouldn't we?
Yes, we would. So with the Medicare eligibility enrollment, you need to be in Part A and Part B. We talked about that, and pay those premiums if they apply, which Part B is going to certainly apply. Part A, premium free usually. You've got to be in the coverage area. You're using their network again. And October 15th through December 7th is the annual election period for AEP. And that's when you can see the new plans coming up for the next year. And you can kind of see what benefits each one of them provide to you. And you can determine whether or not, it's a year that you need extensive dental work. For instance, you may go back and look and say, okay, which plan has the best dental coverage this year? And like I know in Kansas City, I think there was one that I think the max I saw was a $2,000 a year benefit, which was pretty generous. But they vary from provider to provider, so you have to do some due diligence associated with this.
And you also have to remember that the Advantage plans have different contracts with different providers from year to year. So as the SHIP program, we do recommend, if you are in an Advantage plan, you do want to check that during the open enrollment time to make sure that your providers are still going to be covered with that plan, that they still have that contract with that company for the next year. So you do need to make sure that is done, because they can change year to year.
Yeah, don't assume anything, I think, is the mantra. Check each year, and if you do nothing, it's going to roll over. That could be good or that could be bad. You want to be sure. You want to know what you're buying for the upcoming year, and I think that's a very good point. So open enrollment for Medicare Advantage, you can make a change if you're already in an Advantage plan from January 1st through March 31st. So you can make that change. And again, one of the things that we haven't necessarily talked too much about is, can I switch from an Advantage plan back to original Medicare? Can I switch from original Medicare to an Advantage plan? And the answer is yes, you can switch back and forth. But there are some things that we'll talk about that you need to be cautious of, especially if you want to go back to original Medicare and keep your Medigap. So, but again, during this annual period, you can make some switches and switch Advantage plans or switch from original to Medicare Advantage and enroll in that Part D plan. There are also trial periods for Medicare Advantage. So age 65 and older, enrolling for Medicare Advantage for the first time, you begin a one-time trial period, 12-month trial period, where you can go back to original Medicare and your Part D and the Medigap with guaranteed issue during that 12-month time frame. And so that's kind of, they let you dip your toe in the water, if you will, to see if you like the advantage. But if you don't, you've got that trial period that says, okay, I can go back and still get my guaranteed issue, which again, we talked about, they can't charge you more, they can't do medical underwriting, they can't cancel you as long as you pay your premiums. So that's the beauty of the guaranteed issue. So you can still get that in that trial period. So that's as long as the provider is still selling that policy, that is. So that's kind of a, you know, I guess you could say a no risk. You could test it out, see if you like it, and then get it back with your Medigap, which is the important thing. So we tell people, you know, I can't tell you the number of people that I've helped counsel that switched to a Medicare Advantage because they got a free Silver Sneakers membership, but they couldn't go to the doctor that they wanted to go to. And, you know, it's like, I got the free membership for the gym, but I can't go to the doctor I've gone to for 30 years because he's out of network. So we tell people, you know, you got to prioritize these things. So you want to make sure right out of the chute, you can go to the doctors, hospitals, labs that you want to go to. That's the important thing for your healthcare, is go to the providers that you want to go to. Review all the drug costs and coverage. And again, we'll show you how a good way to do that. Understand how much you're going to be paying, because it does change from company to company, plan to plan. So there are HMOs out there with Medicare Advantage. There's PPOs out there with Medicare Advantage. So again, there's good ways to filter out some of these plans to get down to what you want, what's important for you. And don't get hung up on the extra benefits for Medicare Advantage. They are nice. Certainly the vision and the dental are probably the two biggest ones that I think get people to go to Medicare Advantage, because it's like, hey, I get free checkups at the dentist, I get free x-rays, I get, you know, a pair of glasses a year or something, again, depending on the vendor or provider. But again, your core health care is what you need to look at first, and then some of the others. So just be cautious of that. Oops, sorry, hit too fast. Let's do a side by side here with Medicare Advantage and original Medicare with a Medigap. So same scenario. The Medicare Advantage plan that we're going to talk about has a $300 or $3,000 maximum out of pocket and no monthly premium associated with that, no additional premium for the Advantage plan. So you've got a hospital deductible of $1,600. You've got daily charges for a hospital stay at $325 a day or $1,300. Excuse me. You've got the Part B deductible, and then you've got that patient coinsurance of $100,000. Well, because of that maximum out of pocket benefit that I told you about earlier, your total out of pocket for that $500,000 bill is $3,000 for that year, assuming it all happened in the same year. So that safety net saved you because, again, you had a maximum. The plan picks up the difference. You compare that to the original Medicare with Plan G, Medigap, and we said the out of pocket was $226, but you also paid $170 a month, which was $2,040 annually. So, you know, comes out pretty close in this scenario, if you will. But you can add in additional benefits on the Medicare Advantage, like the dental benefits, the vision benefits, and that sort of thing. And you can say, well, yeah, this is probably dollars and cents might have been a better deal for me this year. And as Cindy was saying, if it's a year that you don't have a hospital stay, you know, the Advantage plan would probably win hands down, because you weren't paying $170 a month for a premium for the Medigap plan. So what we've seen so far is original Medicare without any supplement, original Medicare with a supplement, and a Medicare Advantage plan now with the maximum out of pocket. And you see how the amount that you pay is different for each of those scenarios. So when people ask us, well, what's the best thing for me? The answer is, well, it kind of depends. So Cindy, you were going to say something?
Well, I was just going to remind people with the Medicare Advantage plans that they are regional. They do have their networks. Whereas original Medicare and a Medigap, you can go anywhere in the country. So, you know, in this scenario, my question would be, was it a hospital close to home, or did she have to go out of state because of something wrong with her? Because of her heart attack and her illness and maybe her health history. So those are the kind of questions you're really going to want to know, because an out-of-state hospital may not be covered as well out of the region of the networks that a Medicare Advantage plan has. So I think on the next slide, you talk a little bit more about that. I do have another question in the chat or in the Q&A. Can Medicare Advantage plan participants also have supplemental secondary insurance? They can have supplemental insurance as far as if they have Medicaid. They cannot have Medicare Advantage and a Medigap at the same time. That is not allowed. And I think you'll also go into that a little bit. So
Yeah, they don't play nicely together. Well, they don't play at all together. So yes. So kind of what goes into deciding original or Medicare Advantage? You know, can you afford the premiums for Medigap and Part D? Because those are additional with original Medicare. How important is the coverage for like dental and vision to you? I mean, is that a big expense for you? Is that, you know, you've got separate insurance for that? You know, kind of where does that play into it? Choice, certainly, I would say, is one of the biggies, as Cindy's kind of hammered home, is, you know, if you want to go to whatever provider you want, original Medicare is your choice. If you want to go to Mayo, original Medicare is your choice. I think there are a couple, based upon what I've seen, maybe UHC and Humana had maybe a couple of Advantage plans that Mayo accepted, but it's few and far between with Advantage plans from what I can tell. And Cindy, you may know more about that than I do, but that's what
you're correct. You're correct.
Okay. So if that's important to you, it's an easy choice. But if you're okay with staying with providers in your network, and I will say, the networks have gotten a lot bigger, and they've gotten to be regional. Some of them, like I say, are quite large. So you've got the ability to, with a Medicare Advantage, you know, it isn't as bad as it used to be, is what I would say, on the network being very small and closed.
And a lot of the PPO ones for Medicare Advantage plans will have an in-network percentage charge and an out-of-network percentage charge, but you really have to watch the maximum out of pocket, because also their maximum out of pocket goes up for that year that you can hit before you get in there. So
yep. And like I say, the bottom line, you know, there was, we talked about, you know, pay as you go, or you know, or pay in advance. So it's kind of that budget fluctuation tolerance, you know, where are you at for that? So that kind of goes into the choices. So I guess we want to play a little game with you, based upon what you've learned so far on what would you do. And so maybe I'll just paint the scenario, Cindy, and you can have them do the chat Q&A, hand raise, however you want them to respond.
Yep.
Okay. So this nice lady is turning 65 in 2 months, and she completed some aggressive cancer treatment a couple of years ago. She's financially stable. She likes to travel, both in the US and Europe frequently. And the choice of doctors is very important to her because, again, she went through cancer. She trusts her cancer doctor. She wants to be able to make sure that she can go to the hospitals and doctors that she wants to go to. So that's kind of the scenario.
So we're going to raise our hands again and make sure you guys are still there, right? So how many people thinks that she should go into original Medicare with possibly a Medigap? Raise your hand if you believe that's what she needs. Remember the key factors that Gary's talking about. Her choice of doctors is important. She's had treatments for a serious disease, so she wants to make sure it's going to be covered. And she is financially stable, so it may not hurt her to pay for that Medigap cost every month. And she travels, so domestic and foreign. So even if she just travels domestic, she may be out of network if she's in an Advantage plan. So looks like we got a lot of people raise their hands, Gary.
Yeah, and the other thing, since she's turning 65, she's in that guaranteed issue period for her Medigap, so they can't look at the cancer treatments she had several years ago.
Exactly. And when you turn 65 or when you're ready to turn on your Medicare, remember that is the time you need to make that choice. Whether you want to go on the left side of the fence with original Medicare and possibly a Medigap, or whether you want to go on the right side of the fence with a Medicare Advantage plan.
Yeah.
Okay, we have some questions before we go to the next one.
Okay.
If I already have insurance through work and don't need a drug plan at 65, can I waive it without penalty? Now, you can waive it without penalty if you have employer group health coverage that's comparable to Medicare. Okay, if you're actively working, getting a paycheck, or your spouse is actively working and you're on his employer group health plan, yes. You don't have to get a Part D plan or a prescription drug plan until you stop working, okay? Are there supplemental policies available to purchase for dental and vision under the original Medicare? The answer to that is no, but I want you to stay tuned because CMS is talking about possibly 2025 or 2026 adding vision, dental, and hearing to original Medicare. We got our fingers crossed. We're hoping it's coming through. Okay. Some of the Medigap supplemental policies do offer a discount if you go to certain providers for dental and vision, but you really have to ask them that question with those Medigap companies. Okay. What about the MA plans that claim they add money back to my Social Security check, Gary?
Yeah. There are some plans out there, and I think in Missouri anyway, they call them give back plans where, part of that $164.90 that they would waive or reimburse, whatever, reduce. And some would reduce all, some would reduce a portion of. But again, the devil's in the details as far as what you get as far as benefits for that give back.
Yeah, what they're really doing, everybody, even if you're on a Medicare Advantage plan, you are still paying that Part B $164.90 premium, okay, per month. So what the Medicare Advantage plans are doing is they're actually giving you a discount, okay? They're, instead of Social Security sending them that money to manage your care, they're only taking a portion of that money to manage your care. So it's kind of like a discount type of thing. Okay. We have a question about how does TRICARE fit into your scenarios? If you have TRICARE for life, it is a supplemental to original Medicare. Okay. If you have TRICARE for life, give us a call. We'll be glad to explain that all to you, how that works. TRICARE for Life is the only VA plan that does work with Medicare. Okay, any of the other VA plans do not. All right, we're caught up again.
All right, let's go through this scenario. So what would you do So this gentleman's in good health. He plans on to stay on the company group insurance plan for a couple more years. Since he's on the group plan and got insurance, active employer insurance there, he's going to defer enrolling in Medicare Part B. And he's like a lot of guys, maybe don't have a regular doctor, goes to the doctor when he's not feeling good, which might be every 3 years or something. He's had the benefit of good health. So he doesn't really have a regular doctor. And he doesn't really travel much either. He's kind of a homebody, and so not a lot of travel out of state.
So let's talk about this. We're talking about if this gentleman decides he is going to retire and start Medicare, no matter what age he's in, okay, after the 2 years. How many people think that original Medicare would be his best bet? Raise your hand if you think that. Oh, I think we caught a few people. He does have the option to go with original Medicare and a Medigap plan in case, he thinks something may happen in the future, or if he decides maybe he wants to travel later on. But this may be a good candidate for a Medicare Advantage plan. He doesn't care he does care, but he doesn't have a regular doctor that he wants to see for a specific illness or injury in the past. He doesn't travel out of state very much, so he may actually save some money because of his good health with a Medicare Advantage plan. But again, nobody has a crystal ball. If he can afford a original Medicare with a Medigap plan, nobody knows what's going to happen in the future. So he has the option of either way. But if he is wanting to save money when he starts Medicare, he can go ahead and try a Medicare Advantage plan. And Gary, I do say the word try. How come?
Because there's that ability to switch over to original Medicare as well during a trial period.
Yes, you have that trial period that if you're first new to Medicare after the age of 65, if you want to try out a Medicare Advantage plan and see how that works for you, you can do that. But you have to switch back to original Medicare and a Medigap plan within the first 12 months, the first year, in order to have that guarantee issue where they're not going to ask those health questions or they can't turn you down for a Medigap, okay, in case he gets sick later on in the year. Perfect.
Yep.
We have another question. What is IRMA? Do you know that off the top of your head? It's income
related. No, I guess is the answer. Income related.
It has to do with the income that you turned in for tax reasons.
Yeah, I just don't know. I can't. Income related something. Oops, I was trying to look it up quick.
We should always know this one, and they always ask this question.
Income related monthly adjusted amount.
There you go. It's based on your modified adjusted gross income, your MAGI. And it always runs 2 years behind. So if you have IRMA, we do suggest the following year you talk to Social Security about reducing your IRMAs. Okay.
Okay,
Perfect.
we're gonna plow through a couple more because we're getting close to time, I think. So again, what would you do for this gentleman? He's in good health. Hey, he's out there hiking. Looks like he's hiking in Colorado, maybe, I don't know. But he's kind of ignored some dental work that he's really needed to get done. He doesn't like the dentist. He's kind of like me, don't like to go to the dentist, so just kind of postponed it. But now he's going to have to go get some crown and a root canal. He's on a fixed income budget, and he travels to Colorado a couple of weeks a year. Nothing crazy, but he does get out and about some.
So who thinks this guy should look into Medicare Advantage plans? Raise your hands. A lot of people are raising their hands,
Yeah.
Gary. Are they right?
I wonder if that's because original Medicare doesn't cover any dental work.
I'm sure that probably has something to do with it.
That's part of it, yeah. And
Any-
the fixed income budget certainly. Again, when you have with the Medicare Advantage, many times no additional premiums. You've got the maximum out of pocket to help you those catastrophic events. You've got things like the dental and vision. It all kind of comes together, so it might be a good value for him.
Now, being that he travels to Colorado a couple weeks of the year, he might actually think about looking into the Medicare Advantage PPOs that would have in-network and out-of-network costs. They may be different costs, but at least he knows he would have coverage if he was out of the area. But yeah, definitely a Medicare Advantage plan.
Yeah. And, guys, on these, as Cindy has said before, I mean, there is no absolute. People have different risk tolerances. And, even though, an Advantage plan might, fit somebody what seems to be perfectly, they may want the original Medicare with a Medigap. So that's why we at Claim don't really recommend to people what they need. It's just we kind of provide the facts and let them make their decisions because we are unbiased, and it's like everybody wants to have that decision-making process. So now that you know which side of the fence you want to be on here, original or Medicare, how do you figure out the 30 plus Advantage plans? How do you figure out what's best? So going out to Medicare Gov, we talked about that earlier, which is a great deal. And we're going to go out to that real quick. So again, I went out to Medicare Gov, hey, all friendly faces and coffee on Medicare Gov right here. So we can go out here and we can find health and drug plans. You can create an account right here in this first column, which I would suggest that you do. We're not going to now. We're just going to find some plans. And just to kind of show you what's out there, what it can do for you. So I'm going to put my zip code in because it's got to know what plans are in my coverage area. And I can select the type of plan. If I'm looking at just a drug plan, I'm looking at a Medicare Advantage plan, which that's what I'm going to look at. And it's saying, do you get help with costs from any of these programs? Medicaid, SSI, Medicare savings programs, extra help. These are for lower income individuals. You can say, I'm not sure, or I can say, I don't get any help from those. Next. Do you want to see drug cost? Well, sure. I want to see what a good deal this is. And I'm kind of flying through here because I know we're running low on time. So I can add my prescription drugs. I can, let's see. I don't know, Humalog. I'm going to say add drug. And the nice thing is it says, hey, there's a generic out there. Do you want to, it might cost less. Do you want to add that instead? Yeah, I'm going to say, yeah, I'm going to add the generic. It asks me the package, the quantities. I'm going to add it to my drug list. It talks about the $35 cap there that we covered before, which was great. I can add another drug. I don't know.
Lisinopril.
Lisinopril, thank you.
You're welcome.
Lisinopril, boom. 10 milligram tablet, and I've got choices here of, with the dosage. 30 every month, sure, add that to my drug list. It's saying, again, the insulin benefit. I'm gonna say that's all I got. Oops. So I'm gonna say done adding drugs. And here I'm gonna say pharmacies. I want to check the mail order, and I can select up to 5 pharmacies to do some price comparison shopping. Oops, I already had Walmart, sorry. Walgreens, let's do 4. And it went out there and it's looking at all the Medicare Advantage programs in my zip code. And it's telling me up here, you see the lowest drug plus the premium cost. So it's saying the premium cost of the Medicare Advantage plan plus what the drugs are going to cost me each month. It's going to sort it in the lowest order. And so as you see here, it's saying here's AARP, Medicare Advantage Plan 2, it's an HMO. It's got a 0 monthly premium, other than, again, you have to pay your $164.90 Part B regardless. It's saying my total drug and premium cost for the rest of 2023, so it's assuming I'm doing this kind of mid-year, is $245. No health deductible, no drug deductible. Here's that all-important maximum you pay for health services, maximum out of pocket of $4,900 for in-network. And you can get plan details over here. And it also shows the primary doctor, 0 copay, specialist 40. Again, in network, you have to make sure that you can find your doc. And then kind of check marks on what benefits the plan has. Again, devil's in the details. You're going to have to look and see what the vision benefit is, what the dental benefit is, and all of that. I can also come up here and say, you know, I'm just interested really in PPOs, because I want more of a choice that I can get. So I'm going to apply that. And so it's going to go out here. And now I'm just getting PPOs over here. And again, so you got AARP, Medicare Advantage Choice Plan, 0 premium, drug costs $245. You see here, here's an instance where the maximum for in-network is $3,700. In and out of network is $7,500. And you'll see some of the plans that just have an out of network maximum out of pocket. So again, lots of different plans. This Advantage plan does have a monthly premium of $21. And their drug cost was going to cost you $404.88. And it's got a deductible. And so again, this is how you do your comparisons. And I can compare up to 3 at a time. If I just want to see kind of how they stacked up, I'll just do 2, make it easier. And it's going to give you an overview of each of these plans. It says how many stars they have, 0 deductible, 1,000 deductible. So it makes it pretty easy to see kind of where each one of these, the kind of the strengths and the weaknesses of each plan. So again, this wasn't intended to be a class on Medicare Gov, just really something to show you that there are tools out there that you can use to help you evaluate what's best for you, what plans are best for you each year. And these are the same tools that the claim counselors use to help beneficiaries. So we don't have a separate tool. We use the same tool that you would. So we're happy to help you to call into the call center. We get you set up with a session. And that's what we would certainly hope you would do. So save the dates. So we talked about general enrollment, January 1st through March 31st. Kind of take another look at your Medicare Advantage plan, go back to original Medicare, add your Part D. Kind of our Super Bowl at claim is October 15th through December 7th. That's where we see the majority of our clients, frankly, is during this period of open enrollment, where we review coverage. We encourage people each year to review their Part D plan, because it can vary widely, and the plans will change each and every year. And what was covered before in a certain tier may not be covered in that same tier the next year. And if you do nothing, it's going to roll over and you might get a bad surprise. So evaluate it using Medicare Gov or call a counselor, and we can certainly help you with that. And I kind of mentioned this at the beginning, but this is really a rewarding field, being able to help people with something that is so complicated and people get overwhelmed. And you guys are taking a great first step in doing education to try to get your arms wrapped around, the components of Medicare. So I commend you for making it the 2 hours with Cindy and I. That's a feat. I know this stuff can get dry and complicated, and your eyes start to roll back in your head. But you made it. Good for you. If you want to join the team and be a counselor, we provide the training to do that. Great training. Cindy is a wonderful trainer. And as you can tell, knows everything about Medicare backwards and forwards. So me, I learn every day. So things change, and it's a challenge, but it's a great challenge, and helping people get good health care is very rewarding. So that's my pitch for that.
And Gary, you've done a wonderful job today. Thank you very much.
You bet. Cindy, anything you want to close out, or because I think we're at the end of our session.
We do have another question.
Okay.
If you do the 12-month trial for Medicare Advantage, can you go back and get a Plan D and Medigap with no extra fee? The answer is yes. That is your trial right to get a Medigap and get a prescription drug plan. They will have premiums you'll have to pay, but you will not have any penalties during that first 12-month trial for an Advantage plan.
Right.
So good question. I really appreciate you guys being here today with all your good questions. And I think we're ready to wrap it up, Jeannie, whenever you are.
Wonderful. Well, Gary, Cindy, thank you again for your time and for your knowledge, expertise, and for sharing that with our membership. For those of you who have made it through, thank you for joining again this afternoon. Here at Loggers, we recognize that we are just a piece of your future puzzle. And so we're fortunate to have connections with Missouri Claim, with Cindy and with Gary and other outreach specialists. And again, if you are questioning what you may do in retirement, another great opportunity to consider to continue to help. So thank you again, and take care, stay safe.